So hello everyone, this is Jash and today we discuss about the very common testicular deformity is nothing but the hydrocele. So what is basically hydrocele? There is a fluid accumulation is occurs inside the scrotum, that is nothing but the hydrocele. But what is the specific site where the fluid accumulation has been occurs? So firstly understand the surgical anatomy of the testis. So this is the testis and there is a covering around the testis is the tunica labiginia. And there is second covering is nothing but the tunica vaginalis. So tunica vaginalis having the two layers. One is the visceral layer, which is inner layer, and outer layer is the parietal layer. So there is a potential space in between these two layers, and we know that the visceral layer secretes some amount of the fluid inside this potential space, and which is absorbed by this parietal layer. But what happens sometimes the secretory defect has been occurred, means so excessive secretion of the fluid has been occurs, or there is absorptive defect has been occurred, means there is absorption of the fluid by the parietal layer has been defected. So this led to the accumulation of the excessive fluid in this potential space has been occurred. So scrotal swelling is seen, and this is nothing but the hydrocele. So there are the various type of the hydrocele, like vaginal hydrocele, infantile hydrocele, congenital hydrocele, or hydrocele of the cord. Then we see the type of the hydrocele, and the most common type of the hydrocele is nothing but the vaginal hydrocele. What happens? The accumulation of the fluid is occurs only around the testis is nothing but the vaginal hydrocele. Is further divided into the two parts. One is nothing but the primary vaginal hydrocele. It is the most common type, and secondary vaginal hydrocele. In the primary vaginal hydrocele, there is absorptive defect has been occurred. So fluid absorption is not occurs effectively. But in the secondary vaginal hydrocele, there is a secretion defect has been occurred. And the secondary vaginal hydrocele is followed by the secondary to the epididymal orchitis. So what is epididymal orchitis? Epididymal orchitis is nothing but the infection to the epididymis and the testis. Okay, it is the most commonly infection is by the chlamydia. Okay, it also followed by the trauma, tumors, or it also followed by the torsion of the testis. Okay, then we see the swelling. With the swelling in the primary vaginal hydrocele is a very tense, but in the secondary vaginal hydrocele is a very lax. Then we see the testes, which are the separately palpable in the secondary vaginal hydrocele, but these are not palpable separately in the primary vaginal hydrocele. And lastly, we see the transillumination test. In the primary vaginal hydrocele, the transillumination is the brilliantly present, and it is very important. Okay, why? Because in the primary vaginal hydrocele, there is only the absorptive defect has been occurred, so separation is not affected. But in the secondary vaginal hydrocele, there is a secretion has been increased. It is affected by the trauma, tumors, or the torsion or the infection. So if there is a fluid is present is the turbid, and due to which there is a transillumination has been absent. Okay, so how will you manage this vaginal hydrocele? It is done by the jobless procedure and the Lord plication method. Okay, so most commonly done is nothing but the jobless procedure. So how will you perform the jobless procedure? Firstly, we give the incision on the scrotum and exposing the testis. What we see, there is a fluid filled wall, okay, which is covered by the parietal layer. We give small incision on this parietal layer, and fluid present inside this parietal layer which is comes out. So after removing all the fluid from the parietal layer, what we do, we give the wider incision on the parietal layer and everting back this parietal layer, and suturing has to be done. So what the benefit of this method? So firstly, we see that the potential space where the fluid accumulation has been occurred is gone. So the fluid accumulation is not occurs. Secondly, we exposing the visceral layer where the secretion has to be occurred. So what happens? Whatever the fluid is secreted by this visceral layer, which is absorbed by the surrounding structure. And second, we do the Lord plication method. In this method, we are just plicated the parietal layer, means just folding this parietal layer for the decreasing the secretory surface. Then the infantile hydrocele. In the infantile hydrocele, the swelling is not restricted only around the testes. It is present from the inguinal canal also. So there is a inguinal scrotal swelling is present. So how will you manage this infantile hydrocele? So firstly, we cut the excess sac present, and after this, eversion of the sac has to be done. So this is nothing but the management of the infantile hydrocele. Then the next hydrocele is nothing but the congenital hydrocele. So in this type, patent processus vaginalis has been present, and due to presence of patent processus vaginalis, there is a scrotum is directly communicate with the peritoneal cavity. So the content from the abdomen directly goes into the scrotum, and there is nothing but the hernia sac has been present. So there is a question in the exam, and this most commonly asked that what is the management of the congenital hydrocele, and we say the hydrocele word and we go for the Lord plication method, we go for the jobless procedure, but this is wrong. There is an answer is what, there is hernia sac is present, and this is congenital anomaly, and we know that what is management in the infant and the children for the hernia sac is the herniatomy. We do this herniatomy at the 2 to 3 years of the age. And the last one is the hydrocele of the cord. So there is a small swelling which is present along the cord, and the management is nothing but the excision of this. So this is the all about the hydrocele, and how will you differentiate between the hernia and the hydrocele. We see in the next video. So stay tuned and don't forget to subscribe.